Alrighty, welcome back to the Healthy Start San Bernardino podcast, a space where we uplift community-led care, powerful voices, and the people making a difference close to home. Today's episode is especially meaningful. We're honoring International Day of the Midwife, which is a global celebration of midwives and the essential role they play in supporting families, strengthening communities, and reimagining how care can look when it's rooted in trust, relationships, and cultural responsiveness. Here in the United States, and especially here in the Inland Empire, midwives are doing critical work, often navigating complex systems, limited resources, and growing community needs, all while holding space for some of the most transformative moments in families' lives. So I'm honored to be joined today by Alicia Hubbell-Fernandez, a local midwife and owner of La Rosa Midwifery, whose work has shaped not only the family she serves, but also the future of midwifery through her role as a preceptor to student midwives. So thank you, Alicia, so much for being here today. We're grateful for your time and also for your heart. Is there anything before we get started on like diving deep into the conversation? Is there anything you want to share with community?
Just
Talk a little bit about
hi.
yourself or
Yeah,
anything?
hi. I'm
Mhm.
here. Thanks for having me. Yeah, I think that's it. There's nothing much. I mean, I think within the questions, all the things that I'm doing, I could share through that.
Okay. Sounds good. Thank you. Appreciate you.
Mm.
So I just wanted to start with you sharing a little bit about your personal journey. So how did you
Yeah.
find your way to midwifery? Was there a moment or experience or realization that called you into this work?
I would say it was a series of events. It wasn't just like one experience or one event. It was kind of like multiple. I was first introduced to midwifery when I was read a couple books that in them and I thought this is really cool, this is really interesting, this is something that I could do anywhere. It's like a real true skill. Like I felt like it wasn't just like a job, I thought this is really neat. And then um I guess throughout the years, that was when I was really young and I looked into midwifery schools at the time actually, but I
Oh,
didn't
wow.
go
Okay.
forward with it or do much. And at that time, it wasn't a lot. And then I attended my friend's home birth 24 years ago. And that was really amazing and really transformative, I would say. That experience kind of really deeply impacted me. Being there, supporting her for 24 plus hours and like literally holding her legs when my
Oh,
little
wow.
niece came out. So that was really awesome. So that was kind of like, whoa, like I don't know, that I felt like was a part of the story. And then honestly, it was after that I was called to a few births just in a support role for friends. I
Mhm.
think I can be grounding at times. And so friends would call me and be like, you're going to keep me calm. Like I need that during their birthing experiences in the hospitals. And yeah, so it wasn't one event. I would say it's kind of a series. And I truly believe being a firstborn daughter has really helped me also to be a midwife because we tend to be the doers and the bosses, and we're used to that kind of role. So yeah, it was a series of things for sure. And it definitely was a calling. It wasn't just, yeah, a job for me. It's not just a job for me.
Awesome. I love to hear that. So how would you say like your journey has evolved over time?
Well, now, at first I felt like I was very much all in, really kind of didn't have a lot of boundaries, was just like dove deep into the to midwifery and didn't have a lot of boundaries of my own when it came to the work. And I would say now as a mom, that's definitely changed my
Hmm.
boundaries and my limitations and just the way that I practice, I feel like has very much changed because of that. Children, it's always a part of it. It's always been family centered for
Hmm.
me. And I bring in families whenever just as a care provider. But as a mother, the load changes, right? It's like,
Right.
okay,
Yeah.
today he's going to be needing this or that. And you can hear him in the background right now.
Hmm.
That changes kind of how I'm handling and balancing midwifery as well, I would say.
That's amazing. Yeah, my little one's in the background too. I don't know if you can hear her as well.
I can't hear her, but my son is screaming now, so I feel like everybody can hear that. So
I can't hear her. He's being very
okay,
quiet
good.
actually.
Okay, good, good.
But I appreciate you sharing all of that. So what's standing out to me is how personal and purposeful this path has been for you. And
Mm-hmm.
also just highlighting that midwifery is not just a profession, but it's a calling shaped
Mm-hmm.
by lived relationships, persistence, and values. And that calling to the profession is something I've heard pretty consistently from those involved in birth work, specifically midwives and doulas, how they
Yeah.
just felt that they were called to this purpose. And we're just grateful to have you.
Thank you. Yeah, I would
Yeah.
say that the reason that it's a calling too, though, is because it's just a very different, like full on type of work, right? You
Mhm.
can't really even quantify it when you're going to school or you're doing your clinical hours. You can't really understand the like levity of it, but also the on-call life and the realities of that, I think can be pretty demanding. And so it has to be calling deep within. You can't just be like, this is a job where I'm going to make money. Because a lot of times that's what we're going into work for, right? It's like, okay, I'm going to make money. I'm going to support my family. It's going to pay the bills
Mhm.
and this and that. And I'm going to have this separate, like the
Right.
lives, like I would say my life is not really completely separate from my profession, my job, right? Like it's kind of interwoven still. The families that I serve tend to become friends, colleagues, it happens all the time, right? It's like that
Right.
was an amazing home birth. I want to be a doula now, or I want to be a midwife. And I've had those experiences multiple times throughout the years. So it's like it's kind of all together. It's not just like there's a separation. So it really has to be something that you feel really passionate about in order to do it, because that doesn't work for everybody, you
That's
know?
true.
Yeah.
I think having passion behind your work is like really important because it I don't think bleeding out is the word I'm looking for. It really shines through when you're
Yeah.
working with individuals. I think is what
Yeah.
I'm trying to say. That
Yeah.
really
It
comes
carries
through.
over, or yeah.
Yeah,
Mm-hmm.
yeah, and
Mm-hmm.
it's very apparent if you're not passionate about what you're doing, it's pretty obvious. So
Mm-hmm. Oh yeah,
yeah.
definitely. Definitely.
So one part of your work that I want to highlight is your role as a preceptor to student midwives.
Mm-hmm.
Can you talk about what that role means to you and why it's important for you to support and train future midwives?
Absolutely. So I love having students. I've had multiple students. I've had, you know, I think at this point, three midwives that have come out of my practice, or maybe more than that at this point. Um, but I think it's really, really important to keep, one second, so sorry.
Mhm.
That's a Doppler, yeah. Um, to keep midwifery alive and going
Mhm.
is the way that we do that is by training more midwives. Thank you, baby. Thank you. You want to put it on? Okay.
Oh, he's giving you an appointment?
Yeah, he's giving me an appointment. He has gloves on right now. He's because we're in the office. Thank you,
So
babe.
cute.
So keeping it alive is that's how we can keep the profession going, is by having students in our practice, um, and just supporting, the community around. I'm from San Diego, and I moved to the IE about 9 years ago, 8 years ago, something like that. And at the time, I really didn't have a lot of connections. I reached out to all the midwives. I didn't really hear back from a lot of them,
Really?
unfortunately. Yeah. So I felt like, okay, I'm here. I'm going to do this. I'm going to start doing births. I'm going to start taking clients. And I didn't have a lot of support. So I didn't really have a
Mm,
birth assistance. And I leaned on my really close friend, Joanna Galvez, who's in Long Beach.
mhm,
And it was pretty far, but she still assisted me. I assisted her and we swapped, but it felt like a stretch. And so I felt really called to, like, okay, I need to start taking students like soon so that I can train people up to come with me to births and to be part of my community. And I had to kind of create it a little bit myself because I wasn't in the club, unfortunately. Not that anybody was mean or nothing like that. It's just they didn't know me. And so they had their
mhm,
own kind of where they trained, who they trained with. They had their sisterhood, and I wasn't really a part of it. And now I feel like I'm a little bit more integrated into that, but it took a while. So it was really kind of almost out of a necessity too to create more. And one thing that I noticed was that there really wasn't any midwives that matched my energy. There really wasn't, I'm trying to say it delicately, but there really
mhm.
wasn't any midwife. There was definitely no Latina midwives. There was really no POC midwives at all that I identified at that time. And so that's something that's also really important for me, is to kind of have to help populate more diversity within the
Mm-hmm.
community, right? So not just, there's not just one midwife for everybody. I really don't think
Mm-hmm.
that. I think that we all have like kind of who we're supposed to be with. Not that we have to only be with, the population that we are or anything like that. It's just more options, I think, is important for people, just for the community around, who's in our neighborhoods, who's in our direct community, not the community at large, but like
Mm-hmm.
in our areas. So yeah, being a teacher, I take really, really seriously. I had an amazing teacher. Darren Blount was my teacher, and she really kind of gave me a look into all the things, like not just
Mm-hmm.
the clinical hands-on things. Like we have a list of what we have to do, right?
Right.
And we have, these
Mm-hmm.
are our checkoffs. We're doing our list of clinicals, but she went deeper than that. I got to see the back end portion of the business
Mm-hmm.
side of things, just all of it, like messaging with vital records, just like all the things that it takes to run a practice. So I felt that was very, very beneficial for me. And that's something that I try to carry over to students with me as well. Now they're not like, I don't force them to do like admin stuff, but they
Mm-hmm.
do have a portion of that, because you're going to do that when you're in your own practice. So when you're done with me, my goal is that you know how to do everything that it takes to run your own practice when you're on the other side, right? This test is important, but it's not everything. It doesn't tell us how to run a business, how to do all doing your DBA, and like just every part of it. Like I think those things are really kind of missed sometimes in midwifery schools. So for me, it's like I'm fleshing out all of it. That's what's important to me. And so I do skills days, or I host. I haven't done any in a while, but I host skills days so that we can, sometimes we don't learn all the skills within a practice, right? Because, you know, fortunately, a lot of my clients don't really tear when they have their babies, right? So we don't get to practice suturing on a person, or we're not doing it that often, they're not watching it, seeing it in real time. So we have to do skills days where we're practicing on chicken or cow's tongue, So I that's important for me too, so that they get all of it. Because skills are really, the hands-on skills portion is
Mm-hmm.
really important to me.
Amazing. Thank you so much.
Mm.
So, in line with that, what do you hope students gain from working alongside you besides just knowing how to run a practice and all the clinical skills?
Mhm.
Um, what else do you hope that they gain from working alongside you?
Just, kind of balance, learning how to balance midwifery. I think that I don't know that with my earlier students that I gave them a lot of that. I feel like I was
Mm-hmm.
quite overwhelmed and burnt out at the time with some of my students. I had a
Mm-hmm.
really heavy load. And so they probably learned it not because I taught them that, but they maybe
Mm-hmm.
watched it, witnessed it. And so I think that now something that's important to me is that I hopefully can help them understand how to have a balance, or maybe to do midwifery on their own terms. It doesn't have to be this burnout. We're giving our all constantly 24/7, so, 365. That's not really the only way to do midwifery.
Mm-hmm.
So, yeah. And then I think just that they hopefully can witness and see that, like, I meet people where they are, and that care is really individual. Yes, we have protocols and we have kind of standards of practice and care that we do and we implement, but it can be, there's wiggle room, and there's movement with it, because each person is going to be different. Um, yes, we always are serving low risk, healthy people, but for home birth, but we can also do prenatal care only. And maybe we're seeing people that are not super low risk, and we're helping them navigate these systems. So I would say just maybe learning how to meet people where they are.
Mm-hmm. Amazing. Thank you for sharing all that. So,
Mhm.
it seems like to me, like precepting is really an investment in the future. So not just like in skills, but also in values,
Mhm.
confidence, and the sustainability of care. So
Mhm.
your commitment to mentorship is
I'm
shaping
sorry.
what midwifery looks like for the upcoming and next generations, especially here in our region.
Yeah.
So with the efforts that you've done in trying to, you know, make more diversity in terms of the midwifery space, have you seen that expand since you've moved to this region? Like you're noticing more
Oh yeah,
midwife.
definitely.
Okay.
Yeah,
Awesome.
definitely. Not just because of me, but just because people move here too.
Yeah, yeah.
They trained up, they finished schooling throughout this process. And so, yeah, there's great things happening. The Inland Empire is really huge and really big.
Yeah.
There's a lot of different towns in it. And then there's a lot of midwives now. There's a lot more, I would say, but I definitely helped with a few, producing a few of the midwives that are here. But yeah, I definitely feel like there is more diversity now. There are more options. There's more good things happening for just all the birthing people in the IE for sure. Um,
Hmm.
some really amazing programs have come up in just the last couple years, like the doula funding through Medi-Cal, and that's huge. That
Hmm.
was
Hmm.
new. Like having that start has made
Yeah.
big changes and big waves in the whole community, because hopefully that translates to being accepted by more insurances, and then that can also maybe even translate to the midwives having better kind of reimbursement, just by learning from what the doulas have gotten and how much success they've had with those type of programs. So yeah, I think that there's a lot more here in the IE at the moment than there was
Yeah,
when I
and
first came.
and that's good. And I did want to touch on what you said about the reimbursement. So like it's with the global communities and with the Healthy Start programs, one of the things we have been aiming to do by working alongside midwives is helping community to be informed of their options, that they have
Mhm.
more than one option of what
Mhm.
their birth can look like. And having access to midwives kind of informs them and gives them more education around what their birth journey can look like, besides the standard of what we've been taught and what historically
Yeah.
has been the norm. The biggest obstacle I see to that is accessibility in terms of affordability.
Yep.
For me myself, I'm in a two-income household. Me and my husband both work, but let's say if I got pregnant, I couldn't afford to pay for midwifery services out of pocket. It's
Mhm.
outside of my budget range, and I'm sure that is the case for many other families as well. Um,
Yes.
and and a lot of midwives don't accept insurance because the reimbursement rates are so low. So that's
Mhm.
the barrier to accessibility to care. And with all the labor and delivery units closing, with people having issues getting into hospitals for their birth,
Oh
having
yeah.
that alternative, I don't want to say alternative option, but having another option that's accessible and affordable, um, and it should be established in there. And for some reason, it's just not. So I would
Mhm.
love to see some energy around getting, sustainable reimbursement for our midwives. Once you can sustain your work, but also two, so families can afford to access your
Yeah.
services.
Yeah.
Because you
It's
don't
like
just,
twofold.
uh-huh,
Yeah, it's
yeah.
twofold. Yeah.
And I want to say you don't just do births, you do the postpartum, you do the lactation education, and you do well women's care, which means you're offering pap smears, you're offering blood work, checkups, and things like that throughout the
Yeah.
whole reproductive lifespan. So
Mhm.
that's services that are being missed by community members because it's just not affordable.
Mhm. Yeah.
So yeah, I would love to see some advocacy work and some policy change around that,
I
just to
agree.
make it more
Yeah.
affordable. Yeah. Mhm.
Yeah, because we're just really not, unfortunately, it's like we're in the system. We're not traditional midwives in the way of how it was before. We're completely outside of the system. We're within the system, but it's like we have a foot in and we're only like kind of straddling. We're not completely in. We're our What we do isn't really even written into a lot of policies where the funding comes from, where
Mhm.
um the money comes from, where, just any of that. So we're not really there. Like we're not even at the table
Mhm.
half the time. And so the reimbursement, even with insurances, we wouldn't even, it's not even that we wouldn't get reimbursed. They just wouldn't even like accept a claim from us, because unless we're in network. And when we're out of network, what I've seen is, so for like really good insurance plans like PPO or something, I'm still seeing like a quarter of our fee being covered. That's not
Mhm.
reasonable. So yeah, I feel like advocacy definitely needs to happen, and we need to in my opinion, we need to pair up with the doulas and the advocacy that they've had, because the money and the way that they I'm trying to find the right words, but just what they have done at sitting at the table with these different policy changes to get reimbursements for the doula system, like that doula whole program, has made huge changes in a positive way for the doulas. And I think us midwives need that
Mhm.
same kind of energy and that same advocacy, that same amount of people and just know how, because
Mhm.
we're very grassroots. I've served on a few different boards, throughout the years with like Calm and CAM, and those are kind of Calm is California Association of Licensed Midwives, and so they advocate, but it's just so small. There's just not a lot, and midwives can't typically do both, right? It's like being a full-time midwife and an advocate. An advocate doesn't really, it's not really realistic because we're on call. It's like you go to birth, I can't be at that meeting. So those type of things are definite barriers. We need more. I think we need to sit at the table with I can't remember the name of the group, but there's a specific one that has kind of like helped a lot, like push the doulas and advocated for a lot of the way that the current system is working with the Medi-Cal, and then that's transferred over to other insurance companies, right? So I feel like if we got together with them, hopefully we can create a real collaboration. That's what I feel like needs to happen, because the payment and the way that system is working for the doulas is better than what the midwives were getting through Medi-Cal. And that's not acceptable. It's great, right? That's a living wage, and they're fighting for a living wage and all that stuff. But like, why would the midwives be below that? We have, years and years of experience.
And your board certified. You get your license through the board, the medical board, correct?
Yes.
Okay.
Yeah. So that type of thing, it's like, I get the question all the time. I mean, I'm very pro doula. I love doulas. I'm not saying I don't, but I get the question all the time, like, oh, what's the difference between a doula and a midwife? I'm like, well, 3.5 to 5 years of training is the difference, right? So a doula can get a certification within a weekend or a week-long training, not even, usually I think it's three or 4 days. And then you do 3 births and then you're certified, right? Well, and it's not through a medical board or anything like that. And then midwives, we go to 3 to 5 years of school. We do an apprenticeship on top of that. We take a big board exam and we're licensed through the medical board. That's a huge difference, right? I'm a care provider. You're a support person. And so a support person should not be making more money than a care provider through just within and now we don't when it comes to out of pocket, but like I'm saying, we're not in the system. And so I feel like that's part of it. Like we are, but we aren't as midwives. I feel like we're not completely integrated in a good way. Right now, we can take Medi-Cal, we can become Medi-Cal providers, but there's big barriers to that. For myself, I looked into it. It just isn't feasible. It's not realistic because we have to have liability insurance, which is very cost prohibitive for midwives. Okay. So that's something we were paying $800 to $1,000 a month just for that. And then you're doing births for Medi-Cal. You have to have that and a few other things. I can't remember what else, all costing money. And then to bill for the birth, you're getting like reimbursed, $2,000 per person. And maybe 2,500. I don't know. It currently is, but it's not a lot. And if somebody transfers, you basically get nothing. So that's doesn't work out. How can I spend way more money on my overhead and then not get reimbursed hardly anything?
That's not sustainable.
That does not work.
Right.
That does not work for us. I know I've always wanted to be a Medi-Cal. That was like something. It's like, yeah, I grew up on Medi-Cal. My mom had Medi-Cal. We had Medi-Cal. We lived on that my whole life. Of course, that's the people that I want to serve and I want to help. But it doesn't. I cannot make it work in my practice, unfortunately. And there were a few people here accepting Medi-Cal midwives, and they've all dropped off essentially because it wasn't sustainable. Because what ends up happening is people are taking more and more clients to make it work. They're burning themselves out, and it's just not worth it overall. Yeah. But there's a lot there. Like we could go on and on about that. I think there's a lot there, and I'm not necessarily the one at this season of my life to do advocacy, but there's amazing midwives that are doing it, and there are definitely there's energy there. We just need more people within our community, like global communities, and all these these other kind of that are not on call that can do this have the capacity for it. I feel like that's kind of what we need.
Yeah, and as a consortium manager for the Healthy Start San Bernardino program, I listen to community, get feedback from them about things that they're wanting to see happen. And a consistent conversation I've had with community members is now that they're learning about midwifery, they want to have that option. They want to be able to afford that. They want to be able to access midwifery care. Right now, it's just not affordable. So hopefully we'll see some movement over the next few years toward that direction.
I think we just need one thing to kind of push it over that hopefully works, because there's been multiple approaches. There was the Victoria Project in LA. They were funding home birth midwives. They were funding births for folks, mostly Black and brown. But that's where we know that the disparities are, right? So that's kind of where there can be funding for certain things, but that's what their focus was, and they did a good job. But then it was just like it became too much, and I think they had to stop with the funding. But I feel like we just kind of need a program that will really work. And I think, yeah, I don't have the answer for it,
I
fortunately.
got you. Yeah. Well, hopefully we'll see some movement or come in contact with those that do have the answers, but I would
Yeah.
love to see that happen at some point. But
Yeah.
midwifery looks different depending on where you practice. So across the
Mhm.
US, midwives are navigating, like you mentioned, licensing barriers, reimbursement
Yep.
challenges, workforce shortages, and the emotional labor that comes with providing relationship-based care in a system that's not really designed to support it. So can you share a little insight, and you touched on it a bit, but can you shed a little bit more light on what it's like doing the work here and in the Inland Empire, and also what strengths do you see in the communities that you serve?
Yeah. So, I mean, I feel like I touched on it a bit, but
Mhm.
I would say, um, you know, currently the barriers are the reimbursement, right? So, um, I feel like, sorry, actually, can you repeat the question one more time?
Yeah, no problem
I'm,
at all. So I just
I'm
want
all,
to
I
know, like,
had
can
it
you,
and then
yeah,
I
no worry,
lost it.
no worry. Can you share what it's like doing work here in the Inland Empire? Like, what
Yeah.
strengths do you see in the communities you serve,
Yeah.
or what are the realities or challenges that midwives are facing here locally or on a national level?
Yeah.
And you can even touch on, and we did touch on this a bit, but also, what do you wish more people, whether it be policymakers or healthcare leaders or the community, what do you wish that they understood more about midwifery and the practice of midwifery as it is today?
Yeah. So, one second. My dogs are barking. I'm going to try to close the door.
Okay, no problem.
Okay. So currently, I would say, there are strengths within the community. I think there are some good collaborations that are happening with different nonprofits. That's new. That's not something that we had previously or earlier on when I first came to the IE. So having the partnership and collaboration with global communities, Healthy Start has been great. And the doulas, a few different doula groups and things like that. I think that is really been beneficial. Maternal Health Network, like just kind of building bridges, more advocacy, more getting the word out on what midwives do, because we're not just for birth alone. We do prenatal care. We can do prenatal care only. We can do supplemental care. So right now, what you did mention earlier is like there are labor and deliveries closing. There are huge, major, kind of maternal deserts. Like, yes, we're in a desert, but like a maternal desert happening all over the IE and all over San Diego, everywhere right now, honestly, that I've seen, at least in California. Um, and so we can help supplement a bit. I think we're overlooked in the way that we can help, and maybe we have capacity. We're not a clinic, or we're not dependent on these certain things. So that's a benefit to being outside of the system a little bit, I would say. But I think people don't always know that about us, that we can do well person care. I can do blood work. I can do STI panels. I can do genetic testing early on, or lab work needed. For example, I have a client who's seeing me from Indio, and I don't serve Indio, but she does not desire a home birth. She just needs care. And she was a transplant from out of state and couldn't get into care. She was already 22 weeks and they just wouldn't see her. So she's
Wow.
not getting able to get any OBGYN care where she's at currently. She reached out to me and she's willing to make the drive because she just is like, I need care and I like midwives. I had a midwife with my last baby. I don't want a home birth. She has her own individual things going on. But so things like that, I feel like it's important to realize that we are actually a lower cost option when it comes to
Mhm.
being reimbursed. Like I feel like insurances need to understand that better, but we can do a lot more than just the birth itself, right? We're doing more than that. And then postpartum, we do a lot more appointments postpartum. And yeah, we can do well person care as well. So yeah, I don't know if that answers it completely, but
Yeah,
I think that's
that's
a
good.
strength within the community. I think word of mouth is really beneficial. To getting the words out the word out about things that are currently happening, like resources and stuff like that. Like midwives tend to be a bit of a hub, right? It's like we
Mm-hmm.
have in our communities, hopefully, we are somebody that you can reach out to and ask questions to, not just because you're pregnant and not just because you have had a baby with me, but like ask your, come to me. At least that's how I try to practice and how I am in general. Um, so people can reach out to me, they can ask me questions. Obviously, if it's medical advice, I can't give them that, but I can definitely guide them in the right direction and help
Mm-hmm.
hopefully link them to resources and things like that.
Amazing. Thank you so much. So, Alicia, from what I know, is you're very deeply connected to the community, not just as a care provider, but also as a partner. And when you have the space for it, you do get involved in advocacy efforts. Um,
Hmm.
so, can you talk about ways that you're currently engaging with community or how your work? Then you have touched on it a bit about how your work
Yeah.
extends beyond individual births, and what does community-centered care look like to you in action?
Community is really, really important to me. So, we came here about 6 years ago to Hemet, and at first, you feel you're a transplant, right? So you don't really know
Mm-hmm.
the lay of the land and the ground, but like I feel like in the past years I feel like I've gotten a lot more rooted in the community. And that's really important to me because this is where I live. I want to feel comfortable, I want to feel safe,
Mm-hmm.
I want to feel like a sisterhood or a communityhood, whatever you want to call it, where I'm at and where I live. So it's very, very important to me. And some of the things that I'm doing is I'm paired and coupled with Global Communities Healthy Start,
Mm-hmm.
we're doing childbirth education. So we do the groups weekly right now. We do free childbirth education and a lactation hour after that. So breastfeeding support, infant feeding support. It's not just breastfeeding, it's beyond whatever you need. Myself and another IBCLC in the community help run that part. And just creating more free resources, right? Because this is a lower
Mm-hmm.
income valley in general. So that's something that's really important. Previously, I was at the WIC office offering a free just breastfeeding and infant feeding support
Mm-hmm.
group. That didn't really continue, but now we're paired with global communities, and that's really beautiful because it's needed here. And so I'm building bridges slowly but surely. There are there's another organization that I'm trying to work with just to get more groups going, right? So but doing this work not just out of the kindness of my heart, like you do need to make money, and that's something that I've learned
Mm-hmm.
throughout my journey is how do we get funding for these things that we're going to do. But yeah, so but also uplift the community, right? So that's what I mean by it's not just a childbirth education. We're not just talking about stages of labor. We're going over a lot more than that. We're going over what is the optimum positions to be in, what are some positions you can do for discomforts, right? When you're pregnant, your lower back hurts, you have muscle
Mm-hmm.
aches, your round
Yeah.
ligament is going off on you.
Yeah.
It's not comfortable. So it's
Right.
like, okay, we're not just gonna be like, okay, we're just gonna go over labor. We're gonna talk about, okay, how can we ease that up? Why don't you try this position, that position, this position daily so that you're kind of set up for success when it comes to your labor and delivery. And then we talk about the beyond portion, right? So we talk about what is newborn care. What happens when you have your brand new baby and they say, okay, bye, you're gonna go home from the hospital. There you
Right.
go, keep that thing alive, okay? It's like not like when you're in school. It's a big
Right.
deal. So how do we
Yeah.
prepare our moms and our families for the postpartum period? That's a huge portion of my group that we do because that's important, right? Like what's normal for a baby? What's normal for their temperatures? What's normal for their pees and poops? What's normal for how often they should be eating? You should know all that stuff. And that's a lot of times nothing that your pediatrician is going to go over, nothing that your OBGYN is going to go over. That's definitely a supplemental thing. And so being
Mm-hmm.
able to have that as a resource, I think, for the community is really huge. Um,
Mm-hmm.
and so, yeah, I feel like that and then like lactation and we just did the healthy steps happy families walk,
Mm-hmm.
which was really great. And I used to do walks weekly for all of my clients when I was in Riverside. We'd meet at the Botanic Gardens and we would do it. And it was just a way to be able to say, hey, you were my midwife, or maybe you weren't, you're just pregnant. Why don't you come have a walk? We're going to get our steps in. We're going to get fresh air. And you can
Mm-hmm.
ask me questions about what can you do for indigestion that's causing you havoc right now because you're 29 weeks and everything is smushed, that type of stuff. So just being more kind of available to the community at
Mm-hmm.
large and having a more holistic approach, I think, is something that people desire, but doesn't mean that they have to have a home birth because they like those things. They could still want the holistic approaches and still plan for a hospital birth, you know? So,
Awesome.
yeah.
Thank you.
Hmm.
So I'd like to close by asking for your reflections and advice to different groups who may be listening to this podcast episode, and you can take them one at a time. So
Hmm.
first, I wanted to start with for families. So what would you want families to know about their options, their voices, or their power in the perinatal care journey?
So for families, what I really want for them to know and to remember is the acronym BRAIN. So BRAIN is, what are the benefits? What are the risks? What are the alternatives? What is my intuition telling me? And what happens if I say no? That's
Mm,
something that is advocacy for all things medical, all things,
I
any
love that. I don't think
procedures.
I've ever heard that.
Oh, yeah, I love
Yeah.
that one. We teach that in our childbirth education too. But it's just a way of having a little bit more of like slowing things down because in our society, things are fast. And in medical systems, unfortunately, a lot of our doctors don't have a lot of time. And it's not against necessarily anything negative against them, but to slow it down sometimes is all we really need to do. And so I feel like that's a big part of that. And to advocate for ourselves, that allows us to have the tools to advocate for ourselves.
Well, I really love that acronym. Can you say it
Mhm.
one more time? So
Yes.
brain, it's
What are the benefits? What are
benefits.
the risks? What are the alternatives? What is my intuition telling me? And what happens if I say no?
Amazing.
So the benefit, risk, alternative, intuition, no. And so, yeah, I feel like that's a huge tool. And I tell that to my family, like my personal family, when my
Hmm.
grandma's going in for all her heart stuff, my mom's going in for all her heart stuff, I'm like, we're slowing it down. I don't necessarily say all of those, but I'm sort of, those are the
Hmm.
questions and how I'm framing my questions when I'm advocating for family members that are, yeah, that unfortunately, that's where I'm at in my life. I'm having to navigate for my elder family members and stuff.
I
So,
get it.
yeah.
Yeah. Absolutely. In your personal life.
Yeah.
Or advocate for something.
Yeah.
So, for aspiring or current midwives and birth workers, what encouragement would you offer, especially those navigating long days or uncertain systems?
Um, what do I want them to know, right? Is what you're saying.
Mhm.
Just, that there is a community here that you can lean on and reach out to. Don't feel shy, don't feel nervous. Because at the end of the day, once you are on the other side, we will be your peers and we will be your community. So sometimes, I mean, personally, I feel like I'm very approachable and somebody that people do feel comfortable reaching out to me with questions or concerns or wanting mentors and stuff like that. But not every midwife is. And sometimes we are busy and we don't answer. But that we're still here. We are a community. So just tapping into that, sometimes it just takes a little bit of confidence to do it, but we are here to support you. And just remembering to breathe and to take time when needed. It doesn't have to be a fast process. It doesn't have to be something that you push through. I feel like, yeah, and have grace with yourself because it's a really hard thing usually. It's just like birth. There's that transition where you're shedding
Mhm.
your whole entire old self. I feel like that 100% is also true for being a birth worker and a student midwife.
Interesting. So, for healthcare professionals, what supports collaboration and mutual respect across models of care?
Um, Going to more events, right? So doing things like the Maternal Health Network, going to more symposiums or groups or things where there's going to be multiple providers at the table, I think can really help
Hmm.
us to just be in the same room. And sometimes that's just the
Yeah.
the the bridge that needs to be there and discussions that can be had. But I think that's a tall ask, but definitely I think that's a starter or a way to kind of maybe build some bridges for collaboration.
Mm, interesting. So, for the broader community, how can community members support midwives and birth workers locally?
Mm, that's a really good question. Um, Maybe join CFAM, California Families. I think it's something midwifery. I can't remember the middle part. Um, and just kind of be in the like follow local midwives, kind of reach out and see, go to their events, have conversations with them. I think that's a way to kind of just um, yeah, build bridges there too. But I don't know, as far as advocacy, if there's an opportunity, if I put a link to sign this petition, or if you have time, answer the questionnaire. I feel like those are ways for the broader community to help, is like doing those questionnaires, writing those letters to senators, when we need those little bits of advocacy kind of pushes. That's really beneficial and helpful for us.
Good to know. Good to know. Okay. And you said when you share those links, are you sharing them somewhere?
Yep. Typically, I'm most active on Instagram. It's just La Rosa Midwifery, and not so active on any of the other platforms, but definitely Instagram is the space where I go to often for those type of links. I do have a Facebook, and so sometimes things will be on Facebook too, but I feel like Facebook is kind of going out of the trend a little bit, at least. But yeah, that's kind of where I'm at mostly. And on my website, I post most everything. So there's links to my Instagram and my Facebook on my website. So my website has a lot of my info, has current flyers of things I'm offering at the moment. So yeah, that would be the spot. And that's just also, larosamidwifery.com.
Okay. Thank you so much. So thank you, Alicia, for showing up for families, for students, for your colleagues, and for our community. So on this International Day of the Midwife, we celebrate you and all the midwives whose work often goes unseen, yet whose impact is generational. So your efforts matter, your leadership matters, and your presence is helping shape a more responsive, compassionate future for care here in the Inland Empire and beyond. So to our listeners, if you appreciate today's conversation, we encourage you to learn more about your local midwives, support midwifery-led care, and uplift the birth workers in your communities. So happy International Day of the Midwife, and thank you for listening to another episode of the Healthy Start San Bernardino podcast, where we elevate voices, share resources, and hold a hope for a healthy start. Thank you.
Thank you for having me. Bye.
Yeah, no problem. Thanks, Alicia. Take care.
Bye.